Good afternoon. Good afternoon and welcome to the day one of the Lawyers Wellbeing Week. I am Dr. Defna Ekin. I am a counseling psychologist and the team clinician for New Jersey Lawyers Assistance Program, here with two wonderful panelists who I will introduce shortly. But I first wanted to say thank you for joining, and it is a wonderful number here. Always encouraging to see people joining on a Monday because that tends to be a little bit more of a hectic day in general. So today's focus is on physical health. And as I've said, we have two speakers who generously agreed to share their experience. And I'm thrilled to be part of this effort to facilitate today's talk and eager to listen to the other talks during the week. I know that you might have signed up for more than one. Every day seems to be a very interesting group of speakers and very important topics that we're addressing. So hopefully you'll join for the other days as well. So without further ado, I'd like to briefly introduce our speakers for the day, leaving them to share details of their stories as part of our talk. So I'll start with Scott. Scott Sheldon is a personal injury attorney in Cherry Hill, New Jersey, and he's been in recovery since June 18, 2019. And Nikki Tierney is a licensed professional counselor and a licensed clinical alcohol and drug counselor. She practiced law for nearly 10 years until her opiate use disorder had become so severe, she surrendered her license to practice. She's been in sustained remission from opiate use disorder for nearly 15 years. In addition to focusing on her recovery, she obtained a Master of Science degree in clinical mental health counseling with a concentration in addiction studies. Nikki has a very busy life as a mental health provider, and I'll have her mention the places that she's active in, and you can also find all of these details on her bio at our program. And she is also the mother of four, so she will be telling us about her journey along with Scott as we sort of connected to physical well-being. Welcome.
Hello.
Hi, everyone.
So what I wanted to do is to have a very brief introduction in terms of physical health and how the panelists and I have talked about the connection of physical health to their personal recovery journeys, and hopefully that will be something that you can all relate to, the importance of physical well-being. I assume that we can all appreciate how poor physical health can have a significant negative impact on our overall well-being. So I think that's a good reason to start this week off with physical health as the focus. But of course, it's related to all kinds of other well-being, whether it's mental or spiritual or social. But since today's focus is on the physical, I want to sort of note some of the unpleasant effects of poor physical health. Well, obviously, it can affect us in several ways, anywhere from causing pain and discomfort to decreased mobility and independence, and reduced energy and fatigue. And all of these obviously can be major sources of stress and can affect our ability to carry out our jobs, daily activities, and poor physical health can also have a negative impact on our mental health. Chronic illnesses or injuries can lead to anxiety, depression, and other mental health issues. And unfortunately, the picture is often complicated by the financial stresses of illness or injury. And I would say that nothing is more human than being prone to illness or injury. Hopefully, we'll all be blessed with good health for a long time. But if there's one thing for sure that we'll all have to contend with, the ups and downs of our physical health. And my hope is that we can have a conversation about how regaining physical health can have a positive impact on our overall well-being. Since when we improve our physical health, it can benefit us in several ways, including improved mood, increased energy, greater self-esteem, and overall an improved quality of life. So this is where I want to sort of turn to our speakers, because obviously it's important to take care of our physical health through healthy lifestyle choices involving regular exercise, seeking medical care, preventative care, and among other lifestyle factors. We know that the use of drugs and alcohol have a complicated relationship with physical health. Problematic substance use can cause many physical health problems, anywhere from organ damage to cardiovascular, respiratory problems, increased risk of infections, to name. And by the same token, recovery from drug or alcohol use can reverse or prevent many of the physical health problems. I know that both of you have a history of being in recovery for a long time. And when we spoke before, as we were putting this panel together, I think both of you related well to the physical health aspects of using substances as well as being in recovery. So I want to turn to you to have you share your experiences with our attendees. Perhaps we'll start with Nikki.
Hi, everyone. I'm Nikki. As she mentioned, I have been in sustained remission from opioid use disorder for approximately 15 years. I've also been diagnosed with major depressive disorder and generalized anxiety disorder. I always share that kind of as my introduction to try to hopefully reduce stigma and normalize the conversation about mental health like we do about physical health. If I ever got a call to talk about physical health, I probably wouldn't hesitate, but sometimes mental health, we take a step back. So I'll begin when I was born, because that's when my journey began with both mental health and physical health, which is health and so intertwined, but I did not realize that. I didn't know words to relate to emotions or feelings, but I knew that I never felt safe. I never felt peaceful, and I didn't even know what homeostasis was, or like brain equilibrium. I had intrusive thoughts, I had rumination. And again, because I was a child, I just figured that's how everybody was. I really didn't know any different. One specific thing that I worried about the most was dying, particularly by nuclear war. And we weren't, in a particular nuclear war threat, but it was, again, an intrusive thought. I began playing sports and studying at a really young age because they were able to, I didn't know it, but unwittingly, when the emotional side of my brain was in overdrive, cognitively reading or focusing on a ball or doing repeated foul shots really helped distract the, intrusive thought process. So that was wonderful. I had a lot of success in that. And my freshman year, I'm getting ready to play in a huge basketball game, and I was extremely sick, but not nervous sick. And by the end of the game, I had to leave early. And I realized when we went to the emergency room, somehow I perforated a hole in my stomach, but on the top part of my stomach, which is very different from where ulcers really is. I'm convinced this day was just from all the worrying, all the stress and everything. So here I am, 14 years old. I look very different. I'm, all of 70 or 80 pounds. I had peritonitis, and which is where, through the perforation, I was poisoning my, different organs were shutting down. The air and oxygen were collapsing my lungs. So when I talk about the physical pain, it was unreal. I remember just but anyway, I was on the surgical table, and I felt totally at peace. Out of nowhere, the pain lifted, my fear lifted. The doctor's voice sounded so warm. The table became like a blanket, but it wasn't, a near-death experience. It was because morphine was coursing through my veins. And as sure as it'd take away the physical pain, it took away the mental health worries. I woke up from surgery and was in intensive care for 2 weeks. And every time I had to do something, go walk, do your breathing exercises, my dad would say, can you give her another shot of morphine? Give her this. And so again, unwittingly, the treatment for physical issues and physical ailments were helping me mentally. And I didn't make the connection throughout life. I had a series of other serious physical and mental health for that matter. I was attacked by a dog and needed like 7 or 8 facial reconstructive plastic surgeries. My entire lip had to be skin grafted. I had adhesions from the stomach surgery. I blew out my leg playing sports. And it just seemed like all the time I had pills. And of course, I shouldn't say of course, but from my perspective, everyone also drank. I came from a family where we all drank. So I started drinking at 15 years old, occasionally doing other illicit substances. And all the while, just impairing my physical health so bad, but also thinking I was making my mental health better, but making it worse. Eventually, I got pregnant with triplets. I had triplets in 2000, and then a singleton baby in 2003. All the while continuing to face substantial physical challenges, getting very powerful narcotic substances, and now, though, the impact on my mental health that originally lifted the mental health symptoms was making it substantially worse. I seemingly had everything anyone could ask for. I played Division II basketball and soccer in college. I was an academic All-American. I had this beautiful, beautiful family. And I was just unwell, both physically and mentally. Bottom does not exist. I especially know this now, not from just my anecdotal experience as a counselor. We think with our frontal lobe where there is judgment, where there is causality, and when we have a perceived kind of threat or we don't have our basic needs met, we use our amygdala. And so at some point, I wasn't making sound decisions and the consequences never ended. I did wind up losing custody of the children, have a no contact order for just about a year. As you mentioned, I surrendered my law license, lost my marriage license, my driver's license, my home, many important relationships. I overdosed twice and was saved by Narcan. I began to have grand mal seizures. I was diagnosed with epilepsy because when people would see me in the hospital, they never suspected drug use because of internal bias about what a person with substance use disorder may look like. And so in one seizure, I fell and split my head open and I needed a life-saving craniotomy. To this day, I'm deaf in my left ear. I have no sense of smell and I have very slight Bell's palsy remaining. For a while. It was profound, where half of my face was completely, completely paralyzed. I went to jail, committed to psychiatric wards, and physically, I was unrecognizable. I looked nothing like I ever had, and mentally, I was just completely lost. Sadly, the girl who was always so afraid to die tried to take her own life in 2007. 2 years after the brain injury, after the overdoses, which again, I say because there's no bottom, it's such a fallacy. I used substances to escape pain, physical pain and mental pain. And the system somehow thought, keep piling pain on her, strip her of her children, strip her of her dignity, strip her of her freedom. But the pain only increased my need to use the only coping mechanism I had. And it was only when I received evidence-based psychiatric care after my suicide attempt that I slowly began my journey of wellness. Amazingly, I have not had a seizure in 15 years since I stopped using drugs. I again have some lingering impacts. My physical health is markedly better. I do I manage emotions with food, which has been an ongoing issue as, I journey towards wellness. I think I've gained and lost the same 50 pounds, probably 10 to 15 times, but I'm now understanding the interplay in all of them, and that taking care of myself, loving myself, recharging myself equates to better mental and physical health. It's almost nonsensical, but for so long it completely escaped me. So I do have some lingering impacts again of the disorder. Dealing with the mental health is definitely challenging, but as I always say, I am so happy, I'm so fulfilled, I'm so grateful. But occasionally I do experience the symptoms of depression, generalized anxiety disorder, and psoriasis. I have psoriasis. So I have physical conditions too that, guess what? I don't think my way out of, I don't shame myself for, I just treat and support myself as best as I can. So thank you all. I want to make sure we leave plenty of time for Scott and questions. Thank you all so much for having me. And, you know, very grateful to speak.
Thank you, Nikki. That really is description of how all of these things have very complex interactions, and sometimes it's very easy to overlook how the physical starts the problem, contributes to the problem, and taking care of oneself. And recovery can't just be from substances or from mental health conditions, but also physical well-being. Recovery from physical difficulties supports all of those efforts as well.
I guess that's me then, huh?
Yes, thank you, Scott.
Thank you, guys. That was great, Nikki. That was comprehensive. I appreciate that. So where do I start? I guess I start at the beginning too. I was born locally in South Jersey to a good family. You know, and it's funny, as Nikki kind of talked about, I always had the sense of not feeling or being like other people, you know, like not fitting in. And, you know, I was kind of compounded by having, I could say, learning disabilities. And as I went through school and I guess my unhealthy relationship with substances started back when I was 16. I was a freshman in high school. And I was diagnosed with ADHD, put on a medication called Adderall, and put on some other medications at night to go to sleep because Adderall gets you up. And so, you know, I got to the point, I guess, where when I needed to do something or feel something or function in a certain way, I would look to substance. So if I need to study for school, I'd take this pill. When I need to go to sleep, I take that pill. When I need to chill out, I'm gonna take this. Or I'm gonna smoke that. Or I'm gonna drink this. If I gotta fit in with the crowd, I'm gonna drink that. Like, you know, I had a chemical answer for every situation. You know, I went on to, I guess you could say, I could underachieve my way through high school. Went on to college. Underachieved my way about halfway through, and then decided to apply myself. Got into law school, and you know, I would say I was a partier in college for sure. You know, I had the probably the 4-day weekends. You know, start them on Thursday night maybe, and then sometimes you'd have to call out or not show up to class on Monday. But at law school, everything kind of took a different turn. So it wasn't a party on the weekends anymore. It was a study all day, go to class all day, drink till I fell asleep, or drink and take some pills till I fell asleep. And I was living alone for my first time, no roommates, nothing like that, nobody to keep me in check. So I was doing it every day. I was doing it every day. And look, I'm going on 4 years in recovery in June. So up until 4 years ago, it was every day. All right. And it didn't slow down as, you know, life got more complicated and I had more responsibilities. Because look, I got married. I had kids, 2 sons. I started practicing as a trial attorney in New Jersey, South Jersey. Trying cases, just all types of responsibilities. And guess what? You know, drugs, alcohol continue to get worse. You know, they say that substance abuse, or alcoholism, whatever you want to call it, is a progressive illness. And I can attest to that because, like I said, I started off as a regular, college kid who partied hard and got to the point where I couldn't imagine a day, a minute, a moment without the help of something. And, saving you all the details, it got to that point where I was, every day, all day. And that's the only way I could focus, or that's the only way I could function. As a lawyer, as a parent, as anything. It was like being on a hamster wheel, and sometimes I describe it as spinning plates, explaining all these different plates in the air, trying to, be a good dad, be a good husband, be a good son to my parents, and be a good lawyer. That none of them were me. None of them. There was one person in the world who knew actually me and what was going on in my mind. And it wasn't even me. It was my drug dealer. That was the only person that knew the real guy. He got to see me in the morning, all stressed out. It's crazy. So, everything, when one of those plates that you're spinning starts wobbling and falls down and all the other ones fall down, that's what happened. It all worked for me until it didn't. I was able to, maintain the career, maintain, everything with my family. Obviously, you're not doing the best you can. You're not giving 100% because you only give it one thing in the world 100%, and that's the chemicals. So you kind of do the best you can, and it worked until it didn't. And when it didn't work, it was a catastrophe. And I couldn't imagine my life without drugs or alcohol, and I couldn't imagine it with it anymore. And like Nikki, that was it for me. That was the decision. My kids would be better off without me, and that's it. I've come to the end of my journey. Fortunately, things didn't go as planned, and I'm here, and I'm in recovery. So, physical well-being. Where do I get there? So, I am. There's a couple things. Number one is routine for me. I used to have unhealthy physical routines. Having a breakfast of alcohol and drugs, and not eating. Being on a schedule with when you got to get high again, and on that routine. And now, I'm kind of on a routine of I eat the same breakfast every day. I wake up the same time every morning. I go to sleep the same time every night. It sounds boring, but routine is the new excitement for me, because I lived a roller coaster. I lived on a roller coaster for decades. So having a predictable, simple routine for me, I love it. What else? I also, physical fitness, running. I run all the time. I work out. I keep track of all this stuff. I have a watch that takes all this data down, and that's what I get off on. I like it. Where I can tell you is I used to be into the fitness and health and all that too, lifting weights and going to the gym. As my usage got worse, my fitness went, okay. And look, I got my share of accidents and injuries and hospitalizations and surgeries and recovering from, major injuries, just rough. And it made it so much harder because when you're limping around, and you're already feeling like crap up here, and your body's hurting too, doesn't make it any easier. So the getting this right and then getting like this right is kind of the way it went for me. Getting my head right, taking care of those issues, and then making my physical health a priority. Whereas I used to avoid doctors like the plague. And if I was at a doctor, I was lying to them. How many drinks do you have a week? On 2 or 3, an hour, going to doctors, getting my blood work. I want to live a long life, and I'm doing what I have to do in order to do that. Whereas in the past, I didn't want to live past tomorrow. So I don't know. That's what I got.
Thank you so much, Scott. I think that is a very powerful story in terms of not only how everything started going badly. And, I was really touched by you saying that you couldn't be any of these people that you wanted to be. You couldn't play any of the roles without the use of something. And also what you've highlighted in terms of the routines, the exercise, the sleep, it does seem like a lot of your recovery has been strengthened by doing things that impact your physical well-being. Would you say so?
Absolutely. Absolutely. I think I really do think that I've replaced my old negative routines with positive, healthy ones. Because, what's the drug addict? Somebody who follows the same schedule every single day. And that's, they have to follow it. They have to, have what they need at a certain time. And if they don't, they're not going to feel good. If they don't feel good, they're not going to be able to do this, they're not going to be able to do that. So, as crazy as that is, that was routine for me. So now, having replaced those habits with positive ones and, good ones that aren't rewarding for just an hour or a half hour or whatever, that actually, it's like an investment. Every day you feel better, you get better, your health gets better, you challenge yourself more. It's got more long-term impact.
Thank you. What about you, Nikki? How have you seen the connection of changing physical health-related routines, structures in your life, and how that's connected to your recovery efforts from substances?
So in the beginning, I didn't have a driver's license, so I rode my bike everywhere. And I almost like accidentally realized how well you feel the proverbial runner's high. So whenever we're exercising, our brain is releasing very important chemicals, endorphins, serotonin, and all of just positive feel-good mechanisms. And especially if we're in, post-acute withdrawal, our brain is not making those chemicals. So physical exercise is wonderful. I too, Scott, would, I got one of those odometers to know exactly how many miles I had. And then I started obsessing about that because, again, in the beginning, I felt like, I stopped taking pills. I'm cured. My problem is over, not realizing how much recovery I had to do. So I went kind of from, using pills then to compulsively exercising and weighing foods and doing that. And that's where, and I saw the other question too about other addictions. We call it switching seats on the Titanic, really. substituting one maladaptive behavior for another, or something really healthy and then taking it to the extremes, which I was doing. So to correct extents, somebody mentioned on there too, a hobby. I do counted cross stitch. The creativity regenerates the gray matter in our brain. It's just amazing. And whatever it be, whether it be going outside to walk a dog. I don't know if you can see in the background, that's my dog. She's a therapy dog. Whatever it is, petting your dog, going outside, gardening, getting dirty. It's just wonderful to connect. But I think the kind of prima facie case is we've got to heal ourselves. We have to find our fullness from inside, and then running, working out, therapy, dogs, a new career, that can complement my wellness. But until I address the kind of, for lack of a better word, root causes of it, just like the question asked, it went from one addiction to another, then doing this, then doing that. And again, not realizing the pills were just how I dealt with my challenges. The pills were never the problem, ever.
Yeah. Thank you so much, Nikki. That gets me to one of the questions that were on the Q&A. The question was posed: if the reality of the human condition is denial of the strongholds on our lives and blind spots, then how do you pierce that wall of denial? And that question to me could be asked in terms of any kind of denial. Whether it's being in denial that your physical health is not where it should be, or if you keep at this rate, you will endure more physical problems, or recognizing that your substance use has become problematic, recognizing that even something very healthy like exercising has gone towards the more compulsive. I think that question really is a critical one in terms of how do you start if you can't stay in denial? And I'm sure that both of you can relate. And what I wanted to sort of share as a psychologist, and you're a fellow mental health provider, Nikki, I'm sure that you see this a lot as well. But unless we can recognize and own our vulnerabilities and accept the fact that it is okay to be struggling. It is okay to not be in the best physical health. It's okay to be a work in progress. As a matter of fact, we're all works in progress in terms of our physical well-being. Could we use a little more sleep hygiene? Yes. Could we do a little better in terms of our nutritional habits? I'm sure. Could we vary our exercise even if we're exercising? But I think for our panelists, given that this is a Lawyer Wellbeing Week, again, I'm not a lawyer, but I have been around a lot of people who are high achievers and smart, and finished all kinds of very difficult courses of education and professional journeys successfully. So it becomes harder, in my opinion, for people to admit that they're struggling with something once they're sort of looking successful on other fronts. I wonder if either Scott or Nikki, you have thoughts on how accepting that you're struggling works with, on the surface, things look great.
That's a good question, because for me, there was no acceptance of me having a problem until it was too late. So what I would think, and what I could try to say is, well, what does it really take to get away from this denial and honesty? We're really honest with ourselves. But good luck telling someone who's out and drinking and drugging or whatever they're doing to be honest with themselves. It's like they catch 22. What I can tell you about myself, though, as a lawyer, I couldn't be doing what I'm doing in recovery if I didn't bring it into the office too, and just be wide open about it. I mean, I'm on this panel today because, you know, recovery for me is one of my greatest, if not the greatest achievement in my life. Okay. I'm proud of it. I'm more proud of it than the jury verdict I got a couple weeks ago. More proud of it than, you know, when my kid scores a goal in soccer. You know, it's number one. So I struggled early on going back to practice, you know, because I took my time off. I went to rehab and, you know, came back and was living in like a sober living house. Before I went back to the office, I kind of struggled with, you know, who am I? What, how do I act? What do I say? Because nobody knows why you disappeared. You know, they get a FMLA request and that's it. So I had to just own it. I felt like I lived a long time with secrets, with not being myself, and in order for me to move forward with it and, you know, accept it, I had to be proud of it. I had to be proud of who I am and where I've been and how I got here. So I don't know if I'm answering your question. I know we were talking about denial. I guess as in order for me to get over denial, I had to embrace recovery with the same, if not more enthusiasm than I embraced, you know, running around back in the day.
Thank you. Thank you. Well, to me, that's a very good description of how denial is in layers, right? Like you kind of break it and then you kind of go back into it. And it seems like for you, when you embraced recovery, you could also see all of the other areas that you've been overlooking and sort of pretending were fine. And I think that's really an important factor in sort of recovery from the physical aspects of having used substances in a compulsive way, as well as the emotional recovery from it. What about you, Nikki? How do you feel about that piercing of denial, whether it's, what you said a little earlier, like, oh, I'm off the pills, I'm good. Well, that's another kind of denial, right? So how did you experience that process of working out your way out of denial?
So I began with more conventional self-help groups where denial stands for don't even know it's a lie. And it's not just a river in Egypt or whatever. And it was a bad thing. You're in denial. Get it together. Face it. I've come to learn that for me, denial is a very harsh word. It was a protective mechanism. Again, having begun using substances during the developmental stages of my brain. And this is not at all to abdicate responsibility, but my brain was different. My brain sent a signal, you need to fix this. And the only way I knew how to fix it, Scott, kind of like what you alluded to, substance. Baby's born, substance. Somebody dies, substance. And I didn't, it wasn't even so much as denial, as just, it was a part of who I was. Again, structurally, my frontal lobe changed. So when all you have is a hammer, everything looks like a nail. And I felt like I was being persecuted and I couldn't look at things logically. Again, I say this, so humbly, it clearly very intelligent. I got straight A's in law school, straight A's, everywhere. And I can't see that I'm existing on the street because I'm not well. It's because, but anyway, what we do with that, if you have hopefully a learned counselor or a professional, we use what's called motivational interviewing to take a look at how your life is, how you're living it. What benefit is being served by this behavior, that behavior? We don't tell you the behavior is no good. We don't tell you to stop the behavior. It's all about insight. And I've been able to change many things that, again, denial, or I like to phrase it, maybe just a lack of acceptance. We have the 4 parts of our brain, Johari's windows, the one that all of you see me as, the one that I see myself as, the one that everybody sees me as, and then the one that nobody sees. And accessing that, I believe, is insight, patience, and, I had to give up a lot of my cognitive distortions about who I thought could have substance use disorder, what I thought about people with mental health challenges. And I'm still working on it. The things I've done, I have not been able to shut out. I say what 50 times a day, and I'm constantly reminded, but just trying to remind yourself that, it's not as clear as denial and truth. It's a lot of things that are protective. We live in survival mode at that point. Yeah. And so it's more like exploring, even to sometimes something will really bother me. And I'll say to myself, what about that is causing this reaction, rather than, again, am I denying who I am? Am I having, just to kind of be gentle with yourself, but not being able to see what was fully going on is definitely a result of, the changes to our brain patterns. So denial, I feel, again, is something you need to work through with a professional through motivational interviewing, or again, not necessarily jumping into treatment right away, but just exploring what about this behavior is or isn't serving me. And then we move along the stages of change. And then as we move, we can begin to open up to changing our behavior. But when we're in pre-contemplative, AKA denial, as they would say it, yeah, totally. You don't even know it's there, literally.
Yeah, good points, Nikki. I think that what you're saying connects to a couple of the questions that I'm seeing in the chats, as well as the Q&A. So I wanted to kind of summarize kind of the thread that I see coming up in the chat, in the hopes that maybe you can connect to those, and we can give some answers. So here we are, we're talking about denial of having physical challenges or mental health challenges. And so we've addressed that part. And I see in the chat and the Q&A questions that have to do with, all right, so I am no longer in denial. I see it clearly that things have become really unmanageable, and I cannot go on ignoring my physical health in this way, using substances in this way, right? But the question is, I saw this one that said, how did recovery work in a profession that does not really allow you to have a bad day? Another attendee has posted that they have been struggling with a vicious cycle of stress-related physical illness and major depression and sort of chronic PTSD, so which, obviously you can't even separate those out. And they're saying, however, I cannot take time off because my small firm has no one to cover work in my absence. What steps can I take to hold things together until I get a chance to take the time off I need? So here we are, we're talking about, how to come out of denial. And it seems to me from these questions that even when you do all of those things to recognize, yes, I am motivated to not stay here, let's say, and however way change is going to happen. Now the logistics stuff, I can't take time off. I can't afford it in either financial ways or job security kind of ways. How have the two of you dealt with that?
So I'll speak real quick to when I was unhealthy, and I had been reprimanded by the Bar Association. They did, consider my health mitigating circumstances. They told me to go get counseling and different things. And I had 4 children, and I was in a solo practice, and, the world would stop without Nikki. The world couldn't spin without me. My practice would fail, my children. And I didn't realize that by not, as they say on the airplane, put the oxygen mask on yourself first and then help those around you. I hated myself. I would never prioritize myself. Part of who I was the chaos and the misery and the constant conflict. And because I didn't understand how to prioritize myself, let alone know how and where, I lost all those things. I've gained some back and they've come in different ways. But the most important thing, and I don't want to only make this about me, but I just want to share really quickly, still struggling with major depressive disorder. Very recently, my son was playing college football. We've reunited. They're doing great. And I'm driving to his college football games. But when I go over a bridge, I have an intrusive thought that I'm going to stop and throw myself over the side of the bridge. How do I do this? How do I make his games? As we begin to get well, we have tools that allow us to balance work, life, and wellness. So I think sometimes as attorneys, I know I saw everything in black and white. Either quit and get better or this or that. There are ways to maintain both, increase our distress tolerance, DBT principle, dialectical behavioral therapy, but I don't think that we have to see it as an all or nothing. There's a lot of stigma. First one to acknowledge that you all face that I no longer do being a member of the bar. But I think that, again, it's walking through these things, realizing that this is a chronic and progressive disorder. And if we don't prioritize it, just like we charge our phone, our battery's going to run out. So, and I'm also too, not that I have all the answers, but I'm available offline if people need help with services or however. I'm willing to talk, because that was a huge barrier for me, was my practice, my children, all the reasons I couldn't get well.
Yeah. What about you, Scott? Being in active law practice at the time, I'm even being in recovery, I'm certain that not all of your days are good days. How do you deal with that?
Yeah, well, look, perfection is a hard, if not impossible, standard to live by. So if we're looking for how can I be perfect every day, good luck. Okay, good luck.
Right.
One of the ways I looked at how do I do this? How do I have, 2 kids. I have a full-time job. I don't have time for recovery or taking care of myself. I can't do this. I can't do that. I kind of thought of it in terms of how much money and time did I spend chasing? Okay. Did I spend coordinating, thinking, getting here, getting there, making sure I got my stuff and lining up everything that has to be, perfect for me to get through a day? A lot. And really, what did I need going forward to take care of myself properly? And it wasn't a huge chunk of time. Maybe in the beginning, it's a little more intensive. Okay. But as time goes on, you get more solidified in your recovery. You're not talking about huge, time investment. But look, the job, the small law firm, the big law firm, your solo practice, whatever it is, the money that you want to put away, the kids you want to take care of, none of that matters if you fall apart. None of it matters.
Yeah.
They can't bury you with that stuff anyways. So taking care of yourself does have to come number one. It really does.
That's a good point. And I want to make sure that, sorry to interrupt, but I want to make sure that I kind of connected to one of the questions that I saw, and I think it's a really important one, which was in terms of, so if you have a family member who you see is struggling with use of substances and maybe dealing with addiction, or if you see even a family member who's putting their physical health at risk as a family member. So how do you sort of work through that? How do you answer? How do you respond to those kind of risks that you're seeing? And I wanted to answer that because it's not just about recognizing that we're experiencing difficulties, but also like, what do you do when someone close to you is struggling? And the answer to both, in my experience, my clinical experience, has actually been kind of to go back to the basics and make sure that you take care of yourself first. I mean, I get that we get really worried. I get that, taking care of our children or worrying about our family members sometimes feels like, well, I can't think of myself right now. But unfortunately, unless we take care of our physical health, like eat well, sleep well, and try to move around as best as we can, even those real basic things, like make sure we drink water during the day, even some simple things like that, we are not, as family members, going to have anything to give by way of support, if not hurt ourselves ultimately. And we're definitely not going to be able to see the challenges that we're putting ourselves into. I mean, that's been my experience. I wonder if you can relate to that kind of basic self-care when you're dealing with your own getting better process, as well as trying to be a support to someone else that you love. I wonder if either one of you have any experiences in that.
Yeah, the collateral damage and pain from any chronic illness, chronic complex medical condition, I think we see all over in different, whether it be cancer, having someone we love with dementia or Alzheimer's. And I think that the difficult part is, again, because of internal bias, cognitive distortions, and sometimes stigma. We believe that substance use disorder is a choice. We believe that the person has complete agency to change their life. I know for sure, and rightfully so, my mom and dad tried loving it out of me, buying it out of me, tough loving it out of me, every which way. What we need to understand, again, is this is a complex medical condition. And we need to consult professionals. I saw another question in there about, there's not enough professionals. No, right now there's not. But if and I'm sure Anna I can give additional resources, but really, just like we would never say, my dad has clogged arteries, how am I going to handle it? You're not. The heart doctor is, and then we're going to get support for when he comes home and learned wound care and all of that. And there's craft communication models. There's so many pre-grant funded resource for family members. But the main pitfall, I think, is thinking anyone can control this and having that thing, the cognitive distortion, that this is within my ability to control.
And that's why I was saying that, the idea of the only thing you can control is in some ways maintaining your physical and mental well-being, so that you can be there if they turn to you for support. You can be a listening ear without falling apart yourself. Or spiraling into a problem yourself, because especially when it comes to families, everybody needs to sort of work on themselves to stay in the healthiest place that they can be, so that we have the energy to kind of like help hold the hand of someone who's kind of about to slip. If you're feeling all kinds of weak and fatigued, literally and figuratively speaking, you're not going to be able to help anyone. So I do see that we are, unfortunately, like all engaging conversations go, it's gone by real fast. I really want to thank Nikki and Scott for coming here. We have a few real quick questions, and maybe we can sort of get into those before we wrap up. But I want to make sure to mention and remind everyone that New Jersey Lawyers Assistance Program is available for everyone who's a law student, law graduate, whether you're actively working as a lawyer or not, judge. And it is a free and confidential service that we provide mental health support, among other kinds of support. And I do recognize that, unfortunately, finding a mental health provider, even if you have the resources to pay for it, even if you find that person who takes your insurance, it takes so much more time than, it makes sense to me, unfortunately, but we're definitely a place to come, even if you're looking for referrals. So I want to encourage everyone who's attending to also share and remind people in their lives to use us as a resource, because we're here and happy to help. And I see that a question came up in terms of, have either of you attended A or NA, and what your experience has been, which I know are other great resources in terms of looking for support. So maybe we'll just end with that.
Scott, you want to take that one?
Sure. I know that these are anonymous programs. I won't go into much detail about the programs. I will just say that there's a lot of resources out there, recovery resources, that have kept people in solid recovery for decades. So if you've heard about names of programs continuously and they keep popping up, it's probably because they work. Oh, and I'm going to put my phone number and email in the text box here once I figure out how to get it right. And anybody could call me, email me, text message me anytime if you have any further questions. I know we didn't get to everybody's questions, but I'm happy to continue the dialogue.
Thank you. That is very generous of you. And Nikki, is there something you wanted to add to the last minute thing before we
yeah, just really quick, I wanted to ask, somebody said, how do you know when it comes social drinking to a little more serious? And what I always say is, once it begins impacting our daily living activities. So we're missing work, we're missing our children's game, we're getting more sick. So usually when it impacts our daily living. And then in terms of AA and NA, I'm going to tell you, I do and did anything. I really try to be as well-rounded as possible, open-minded. Some things work a little better than others, but yeah, I find that the more, the merrier. You can just balance, professional, spiritual, kind of like we're doing this week, going through each of the domains. So.
Exactly. And as one last note, in addition to us being resources for referrals or any other therapeutic needs, as NJLAP, we also have other support groups available. We have the Lawyers Concerned for Lawyers groups. We have women's groups, men's depression groups. If you actually go to, this is for the attendees, if you go to our website, njlap.org, you can get information about some of the groups that we have. And again, back to this piece about whether it's recognizing that you cannot physically maintain ignoring certain problems you're having, or if it's actually recognizing that your use of substances have become problematic. Ultimately, it's going to connect to the other one, right? You get physically better, everything else can follow. And I thank everyone for joining. We had an amazing large group especially for a Monday, I keep on saying, and thank you for the questions, and hopefully you'll enjoy the other talks during the week.